Viruses and toxins. How viruses and the diseases they are found with are linked to toxins. Like in the picture here, they are spraying lead arsenate on apple orchards, on apple trees. Although, because they don't realize how dangerous the lead arsenate is, which in fact causes paralysis, they have absolutely no protective covering on them. Research compiled by Joan McGovern-Tandler, Masters in Architecture. So toxins that are related to viral diseases cause symptoms that are the same as viral symptoms. So are toxins the real cause of viral diseases? This is the contents. Harmful effects of toxins are often blamed on viruses. For example, did lead arsenate cause the polio epidemic? Are viruses actually vital immune system activators called exosomes? Do lubricants with trichloroethylene solvent cause human papillomavirus, cervical cancer? Does DEET mosquito insecticide cause West Nile virus neuroinflammation? Does cottonseed poison cause Ebola and other fevers with leaky blood vessels, bleeding, and fatty liver? Do 5G microwaves cause COVID-19, leaky blood vessels? Do dental x-rays and mercury amalgam cause conjunctivitis and maculopapular measles rash? Do Roundup and solvents cause Epstein-Barr virus, autoimmunity, lymphoma, and mononucleosis? Does venom cause rabies, paralysis? To treat symptoms caused by a toxin and to stop the suffering, we must acknowledge and avoid the toxin. People are exposed to many toxins that cause serious damage. For example, 200 chemicals were found in the umbilical cord of newborns, yet toxins are rarely said to cause diseases. There is nearly the same number, 219, of viruses found in humans, and viruses are said to cause many diseases. For example, polio virus causes paralysis. HPV causes cervical cancer, and West Nile virus causes brain inflammation. Yet toxins also cause the same symptoms. Lead arsenate causes paralysis, and the industrial solvent trichloroethylene, silicone sexual lubricants, causes cervical cancer, and DEET insect repellent causes brain inflammation. These toxins also damage the body the same way that the viruses are said to do. Plus, it's likely that those with polio paralysis were exposed to lead arsenate, those with cervical cancer were exposed to TCE lubricant, and the people who developed viral brain inflammation were exposed to DEET. There is much evidence that diseases that are blamed on viruses are caused by toxins. This is critical because you need to know the cause to treat the symptoms effectively. Plus, then you know to avoid the toxin. But if toxins cause these diseases, how do viruses fit in? Viruses appear to be a vital part of the immune system's response to a toxin, called exosomes. Exosomes activate the immune system, enabling us to recover from the toxin's damage. However, if the exosome is dysfunctional, from poor diet, cells low in oxygen, or excessive inflammation from the toxin, the exosome enters the immune component, which deactivates it. Then it is replicated and spreads symptoms like a virus. But the toxin causes the damage, and as long as the damage is blamed on a virus, people continue to be exposed to the toxin. This is what happened with lead arsenate. So the tragic epidemic of paralysis continued 60 years. So did lead arsenate cause the polio epidemic? Lead arsenate was an insecticide widely used in the first half of the 20th century for apples and potatoes. Both lead and arsenic can cause paralysis, and use of lead arsenate in the United States closely paralleled the polio epidemic. Polio paralysis is caused by injury to the anterior horn in the spine, and lead causes paralysis via injury to the anterior horn. The anterior horn is repaired via CD155, which is expressed during embryonic anterior horn development. So with an injury to the anterior horn, this is where the virus, as an exosome, would be sent to. Notably, poliovirus enters at CD155. So less than 1% of people who had this virus became paralyzed because those exposed to small doses, like on their apples, had functional exosomes to activate CD155 to repair the damage. Lead arsenate was used heavily on apples, potatoes, and mosquitoes, as it saw at the front cover. Franklin Delano Roosevelt swam in the Bay of Fundy a few days before he became paralyzed in 1921. The bay was surrounded on one side by the orchards of the booming apple industry of Nova Scotia, and on the other side by the booming potato industry of New Brunswick. So it's likely that the bay was polluted with lead arsenate. As you can see from the charts, DDT and dieldrin replaced lead arsenate by 1952, and polio cases plummeted in 1953. The polio vaccine was introduced 2 years later in 1955. So the timetable was 1892, lead arsenate was first prepared in the United States in Massachusetts. In 1893, the polio epidemic begins with the first large cluster of polio cases in the United States, 26, also in Massachusetts. 1919, lead arsenate is known to not wash off apples, but paralysis due to its residue continued to be blamed on a virus, so it was still used for many years, many years. 1921, FDR swims in water likely polluted with lead arsenate and is paralyzed. 1952, polio cases are at their height, but lead arsenate falls to 18% of the 1942 use. The next year, polio cases plummet. 2 years later, polio vaccine introduced, and 1979, the last polio cases in the United States were in an Amish farming community. 1980s, lead arsenate is rarely used, if ever, and then the EPA banned it. But polio is still found in Nigeria and Pakistan, where lead arsenate is still used. Are viruses actually vital immune system activators called exosomes? Yes, according to James Hildreth, a virologist, HIV researcher, and president of Meharry Medical College. The virus is an exosome in every sense of the word. His words, 2003. They're similar in size and structure, as you can see from a picture of an exosome and a picture of COVID-19. Now here's a real picture of them. You can see the exosome on the left, COVID-19 on the right. Now the point is it goes from a toxin will cause a stressed cell to then produce exosomes, which are sent to proper immune system to activate it. Exosomes take out the garbage during cell regeneration. Damaged cellular components, such as damaged RNA, as well as important immunity proteins, are packaged up in a membrane of fat to protect the cargo from degradation and are released from the cell. During cell regeneration, these extracellular vesicles, called exosomes, deliver their cargo, which are damaged material, to macrophages, immune system components, for disposal. There are many proteins inside exosomes, such as heat shock protein and repair proteins. Spikes of protein combined with carbohydrates, called glycoconjugates or carbohydrate trees, extend from exosomes. These attach to other carbohydrates or sugar in a process called glycosylation. In 2007, researchers made an important discovery. When a cell is damaged from a toxin, exosomes are sent to the proper immune system components to activate them. This is a diagram of a functional exosome. Exosomes activate the immune system. Exosomes bind to the component, then present its antigen to activate it. The proteins and cargo are protected from degradation with a membrane derived from the parent cell. It is made of fats with phosphatidylserine, PS, hidden inside. As you can see in the diagram, the phosphatidylserine is inside the membrane. PS needs to stay hidden because if the fat layer is damaged and PS is exposed, it means the exosome is dying and it will be engulfed by another cell. The fat composition is critical because certain fats are easily damaged, like the highly unstable linoleic acid, which makes destructive free radicals. The field of exosome research is very new, so new that researchers have only just begun to crack the mystery of what exosomes are and what they can do. They have identified an intriguing interplay between exosomes and viruses. Their similarity is so great that viruses are thought to exploit exosome production machinery and to hijack exosomes to transport its own RNA as a kind of Trojan horse. Furthermore, exosomes generated by virus-infected cells can incorporate viral proteins and fragments of viral RNA, being thus indistinguishable from defective retroviruses. Regarding exosome and viral RNA, one researcher remarked that we have virus-like sequences throughout our genome, but we have mostly no idea what they do. Exosomes can even encapsulate the entire hepatitis A virus, providing an envelope to this unenveloped virus. Furthermore, it is believed that exosomes can act as transmitters of pathogen-related molecules that help spread the infection in body microenvironments. S protein spikes are attached to exposed phosphatidylserine in both exosomes and viruses. So, much exposed phosphatidylserine results in many spikes in both exosomes and viruses. See the diagrams here? Dysfunctional exosomes from hypoxic and damaged cells have exposed phosphatidylserine. So, Gas6 and protein S attach to them, which enables engulfment. Now, many viruses also have exposed PS, and Gas6 protein S also attaches to them, which enables engulfment. They're similar in uptake and assembly. Dysfunctional exosomes from hypoxic cells are engulfed into cells due to exposed PS with S protein attached to it. The parts are reassembled. Similarly, viruses commonly have exposed phosphatidylserine with S protein attached to it, so they are also engulfed. The parts are then reassembled. Here is a diagram of the enigmatic exosome, the intertwining of exosome and virus pathways. Viruses and unhealthy exosomes have more protein spikes that are decorated with carbohydrate trees or glycosylated than healthy exosomes. Many proteins are also glycosylated in people with high blood sugar, such as hemoglobin and natural killer cells, which makes these proteins dysfunctional, and so it lowers oxygen and immunity. Viruses and extracellular vesicles, or exosomes, are so similar that it is virtually impossible to separate and identify extracellular vesicles that carry viral proteins, host proteins, and viral genomic elements from enveloped viral particles that carry the same molecules. Infection-induced EVs, or exosomes, and the so-called defective viruses and virus-like particles are intermediate entities, and the border between them seems to not exist. Other viruses and their links to toxins will now be discussed. Do lubricants with trichloroethylene solvent cause human papillomavirus cervical cancer? Human papillomavirus is found in people with sex-related cancers. Over 90% of cervical and anal, and around 70% of vaginal, vulvar, prostate cancers, as well as 70% of mouth and throat cancers. So, HPV is said to cause these cancers. Yet, sexual lubricants may be very relevant to sex-related cancers because the popular silicone-based ones contain a chlorinated hydrocarbon that has been identified as a cause of cervical, mouth, throat, and prostate cancers. The solvent trichloroethylene. TCE is tightly controlled in U.S. industries and is virtually banned in U.S. military and in the European Union because it causes genetic mutations and cancer. Except for prostate cancer, risk for these cancers is increased with early sex, with frequency of oral, vaginal, and anal sex, with smoking, and with birth control pills, that is for cervical cancer. Birth control hormones cause dryness, so silicone lubricant may be widely used. Planned Parenthood says silicone lubricants are safer than oil. Let's go over to this cartoon, and it says Planned Parenthood says to add lubricant to condoms for safer sex. And people should always use condoms. So, in short, for safer sex, always use lubricant. Now, a popular doctor advises to use only silicone, since water lubricants further increase vaginal dryness. So it may be due to excessive use of lubricants with TCE that women on birth control pills have triple risk for cervical cancer. TCE causes cancer by causing genetic mutations. It also activates PHGDH enzyme. Now this is activated in cervical and mouth and throat cancers and with serine deficiency, as well as cancer fighter P53, protein 53. TCE binds to serine in proteins, depleting it, and PHGDH makes serine. It produces serine in the body, and that is needed to repair the DNA. However, PHGDH also generates building blocks for cancer growth, so PHGDH activity is blocked by P53. But P53 becomes mutated with cervical cancer, so tumors grow. TCE also lowers testosterone, raising risk for prostate cancer. In response to TCE damage, exosomes would likely dispose of mutated P53 to restore normal functioning of cells by activating the oncogene HPV-E6. And this is what HPV does. Also, like an exosome, HPV-E6 acts on protein linked to repair TCE damage via the primary entry point of HPV. But with cervical cancer from serious TCE exposure, Wnt is mutated at serine. So it becomes cancerous instead. TCE would likely mutate it with TCE-induced cervical cancer since TCE binds to serine in proteins. HPV also interacts with RB protein, which fights cancer, and this is what an exosome would do. 90% of people who are found with HPV have no symptoms in the case of silicone exposure. This would be because in healthy people, functional exosomes, HPV, would be created in response to the damage and be sent to immune system components that repair the damage and prevent tumor growth. But if someone has a poor immune response and their exosomes, or HPV, are dysfunctional, like from smoking or a very inflammatory environment from excessive exposure, they wouldn't be able to fight TCE-induced cancers, but would spread symptoms instead. Taking serine might help, as serine borate was shown to reduce the carcinogenicity of TCE. Cervical cancer is the second most common cancer in women. Cervical cancer is difficult to diagnose, has a high recurrence rate, and is resistant to therapy. As a result, cervical cancer patients have a relatively poor prognosis. So it's very important that silicone lubricants be avoided. Does DEET mosquito insecticide cause West Nile virus neuroinflammation? See, the symptoms of West Nile virus are agitation and meningitis, encephalitis or brain inflammation, demyelination, seizures, altered behavior, lymphocytic pleocytosis, flaccid paralysis, elevated protein, learning and motor dysfunction, and really the exact same symptoms as they're just called encephalitis, like neuroinflammation on the DEET side. DEET is a form of toluene, so it's an effective solvent. Over half of applied DEET is absorbed into the skin, but when applied with sunscreen or when intoxicated, there's even greater penetration. DEET is highly lipid soluble because it's petroleum based, so DEET can pass through the blood-brain barrier. Neuroinflammation is brain inflammation from a lipid-soluble toxin that penetrates the blood barrier. The cause of most brain inflammation, encephalitis, is unknown, yet they are called virus-induced encephalitis. There are 150,000 encephalitis deaths per year worldwide, all blamed on viruses. Before West Nile virus was identified, there were many serious cases of neuroinflammation from DEET, and there were cautions regarding its use. Since West Nile virus was identified, DEET sales skyrocketed, since people are now encouraged, rather than cautioned, by the CDC to use DEET and to prevent West Nile virus. No, to use DEET to prevent West Nile virus with no restrictions, as it is effective, since it is an insecticide, and long-lasting. Meanwhile, West Nile virus's cases and deaths continue, often with thousands of cases per year. In order to recover from damage in the brain, such as disturbed calcium and acetylcholine channels, which is the way it is in both West Nile virus and DEET neuroinflammation, damaged particles need to be marked for clearance and removed. This is done by the DC sign and mannose receptors, and the mannose receptors also stops brain inflammation. So West Nile virus as an exosome would go to the DC sign and mannose receptors to activate them. In fact, DC sign and mannose are the main receptors for the West Nile virus. But dysfunctional West Nile virus would spread symptoms by being engulfed into these receptors and then replicated. Now, DEET repels mosquitoes, not because they don't like the smell, which is what they want you to believe, I guess, but because it's an organophosphate insecticide that we're putting on our skin. So their feet feel pain on landing. So the timeline here is very interesting. In 1935, as a war-related anti-malarial effort, P. Granite tests 1,000 chemicals to repel Egyptian mosquitoes, possibly in malarial Africa. 1937. West Nile virus first identified in Uganda in Egyptian mosquitoes, where it causes just a fever. It stays mainly in Africa and Asia. 1954. The USDA uses Granite's research and formulates DEET for Army jungle warfare. 1991. Gulf War veterans suffer neurological problems, Gulf War syndrome, involving DEET. So 1992, the next year, New York State bans products with more than 30% DEET. Manufacturers block the ban, perhaps because other states could follow New York's lead. 2 years later, 1994, New York State bans it again. 1995, New York ban on 50 to 100% DEET is blocked again. Then, ABC's Primetime Live reports on the 6,700 cases of DEET overexposure nationwide, including deaths. So, New York State bans 50 to 100% DEET again. Even the Army, a major market for DEET, bans over 33% DEET. 3 years later, 1998, there's one child death from DEET. The EPA forbids child safety claims for DEET, though children are the biggest market for DEET. So many parents switch to safer sprays. Then, West Nile virus from a different mosquito is found in patients with neuroinflammation in New York City, far from its origin, and where 50 to 100% DEET had just been banned for the third time. Unlike the original West Nile virus, this one causes encephalitis and paralysis. DEET encephalitis and paralysis are now caused by West Nile virus. And avoiding mosquitoes is now paramount. So New York State lifted the ban on 50 to 100% DEET, and no state ever attempted it again. 2002, the use of DEET soars, fueled by acquisition, organic growth, and West Nile virus. Cutter and Repel has seen its gross sales increase by 75%. Meanwhile, there are over 4,000 West Nile virus cases that year and 284 deaths. The present. The American Association of Pediatricians says 30% DEET is safe for kids. The CDC says use 30 to 50% DEET. So, from only 4 DEET deaths in 1998, West Nile virus deaths averaged 130 per year. Does cottonseed poison cause Ebola and other fevers with leaky blood vessels? Ebola began in a cotton factory in Sudan. Cottonseeds contain gossipol, a poison that binds with lysine and iron, destroying blood vessels. And gossipol symptoms, leaky blood vessels, hemolytic anemia, and fatty liver, are the same as for Ebola. Cheap African cottonseed oil can contain toxic levels of gossipol, and in 2019, the cost of their traditional palm oil, high in vitamin A, had risen sharply in the Congo. Gossipol also blocks vitamin A, and in a study, vitamin A lowered Ebola deaths. Plus, it lowers susceptibility to gossipol. The oil is also high in inflammatory fat, linoleic acid. Discarded cottonseed hulls are toxic. It's thought that bats near the cotton factory caused Ebola, but bats would eat leftover seed hulls if not disposed of safely, as they are high in protein. So Ebola, as an exosome, would be found in the bats as well. Ebola symptoms are the same as gossipol. Blood vessels vasodilate to expel heat or lower blood pressure, but gossipol blocks normal vasodilation. So the inflammatory bradykinin 1 receptor is activated. So their symptoms are hepatotoxicity, that's the liver or fatty liver, abdominal pain and bilious vomiting, permeable blood vessels and bleeding, arrhythmia, heart attack and heart failure, respiratory failure, rash, pulmonary edema, disseminated intravascular coagulation, hemolytic anemia, low hemoglobin and red blood cell count, labor breathing and chest pain, shock, seizures, anorexia, fever, petechiae, jaundice, hypovolemia, low albumin, kidney damage. These symptoms have been found most commonly in farm animals. They don't really talk too much about that with humans, but all of these are found in farm animals that have had too much gospel. In 2019, the latest Ebola outbreak in the Congo, the price for high vitamin A palm oil rose fourfold as it was bought up by soap manufacturers. So those who came down with bleeding and jaundice could have been eating cheap African cottonseed oil with gossipol, as made in Africa by small producers. A similar outbreak of bleeding and jaundice, the 1576 Cocoa Epidemic, was in a major cotton growing area of Mexico during a drought. So the newly arrived Spanish conquerors may have fed the people cotton seeds mixed in with their flour. Ebola virus entry requires the cholesterol transporter Niemann-Pick C1. A similar virus, Marburg, also enters cells via NPC1. Gospel binds strongly to lysine, thus depleting it, and gospel binds to a lysine in NPC1 better than other substances tested. Ebola can't enter cells without NPC1 and apparently gospel. Since gospel binds to the cholesterol transporter, cholesterol can't be absorbed. So the liver produces excessive cholesterol. This, plus the breakdown of blood vessels, causes Ebola bilious vomiting and heart failure. Gospel's high cholesterol also causes atherosclerosis. As a functional exosome, Ebola and Marburg would be sent to activate cholesterol absorption by going to NPC1 and activating it. Another Ebola attachment factor, B integrins, stops bleeding, so Ebola as an exosome would be sent there as well. Ebola also binds to IRF3 and 7, which induce natural killer cells and macrophages to expel damage. But since the exosome fat covering is made from dietary fat and cottonseed oil contains easily damaged linoleic acid, exosomes are likely damaged and dysfunctional, thus spreading symptoms. So there's many other gospel diseases. We have rum from Haiti on the right. This is the story about that. 1600s. Rum containing lead, called kill devil, is made on Barbados. Now that causes colic, but it's treated with cottonseed oil. Well, in 1647, yellow fever first occurs in Barbados. First stage of yellow fever is cramps, muscle pain, constipation, fever, seizures, and chills. These are symptoms of the lead colic. Second stage yellow fever is jaundice, intense bleeding, delirium, black or bloody vomit, and these are symptoms of the gospel used to treat it. Now, British soldiers drank more rum than the French or the natives, and were also more likely to get both colic and yellow fever. You see a picture of the crude oil. Cottonseed poison is a dark pigment called gospel. Now, the mid-1700s, lead-contaminated rum is imported to the colonies and to England as part of the Triangle slave trade. As a result, colic becomes very common. Rum is also being made in the colonies, some of high quality. Dr. Otto of Bethlehem, Pennsylvania, treated colic with gospel-rich oil. This was used in England also, as lead colic was common. 1764. Dr. Otto presents a dark cottonseed oil that he had made himself to doctors in Philadelphia. They were very enthusiastic. In 1765 and 1788, King George III had symptoms of gospel-treated colic in 1788, seizures, jaundice, and possibly porphyria. Gospel lowers serotonin, so it may have caused his mental illness, depression, starting in 1765. 1793. In spring, ships arrive in Philadelphia from Haiti, which would likely have brought their lead-contaminated kill devil. Rum was widely drunk at this time, even by children, so colic from the imported rum may have become particularly widespread. Symptoms of first-stage yellow fever match symptoms of repeated lead poisoning, seizures, back and limb aches, and constipation. Then, as treated by gospel, symptoms of the next stage of yellow fever, fatty liver damage and jaundice, black vomit, serious bleeding, arrhythmia, a weak heart, and heart failure. That matches symptoms of gospel. Bleeding, a common practice, was used to treat it. But since patients already were bleeding excessively, that may have caused more deaths, the opinion of the time. One of the doctors in charge was Haitian, so there may even have been use of gossipol to treat it. About 4,000 people died. 1803, first description of hemophilia by Dr. Otto's son. Gossipol mutates genes, and hemophilia is an inherited clotting disorder involving low lysine. So their tendency to bleed may have been caused by gossipol given by his father to their grandparents, whom his son would have been familiar with. 1819, King George III's granddaughter Victoria, a hemophilia carrier, was born. 1845-1878, doctors Hort, Rush, and Blue say that the origin of bilious jaundice fevers in the South is rotting cottonseed, and that it's not contagious. 1857, Mississippi bans cottonseed dumping in rivers used for drinking and fishing. 1905, finally the last yellow fever in the United States in New Orleans, which is the center of the cotton industry. 1899 to 1911, cottonseed oil is made into Wesson and Crisco, and dairy cows, pigs, poultry, and fish are fed cottonseed, so gossipol gets into meat and fish. Dairy cows are the source of cheap beef, which, not surprisingly given their feed, raises cholesterol as well as risk for heart disease. So, coronary artery disease, high blood pressure, high cholesterol, fatty liver, likely from gossipol, become common. Giving cotton seeds to farm animals has been done traditionally in many countries, like India, but in India, many avoid eating meat, which would be high in gossipol, and the highest cotton-producing Indian state has the most vegetarians. Cotton is one of the most pesticided crops, adding to its toxicity. Pellagra, a niacin deficiency. It was endemic in cotton mill villages in the early 1900s in southern United States. Cottonseed oil was believed to be a cause. It's cured by improving diet and iodine for the thyroid. You can see the picture from cotton mill studies. High Pellagra village surrounded by cotton fields. Lysine deficiency caused by gossipol affects thyroid and causes niacin deficiency. Thus, low lysine is a potential cause of pellagra. Also, niacin burns fat for energy, so linoleic acid in the oil would have collected in skin as sebum, perhaps from oil on hands and feet, causing sensitivity to sun. Researchers induced a pellagra-like disease in dogs with a diet of corn and cottonseed oil, and then cured them with niacin. This put to rest the competing theory of a cotton merchant's commission that it was caused by an infectious agent. They continue to have pellagra as well as incurable yellow fever in poor cotton-growing countries. 1918. Cotton seeds are widely fed to poultry, swine, and cattle, and swine and poultry often die. Cattle can handle the cotton seeds much, much better. But the swine and poultry will have gossipol symptoms of pulmonary edema, labored breathing, cyanosis, which is blue skin from low oxygen, coughing, runny nose, fever, and liver necrosis and many problems with the liver. These are the same symptoms as swine and avian flu. Spanish flu is a kind of avian flu, thus may well be related to gossipol. It began at an army base in Texas, the largest cotton-producing state. The deadly symptoms occurred from late August to December in 1918 with hemorrhage, pulmonary edema, fever, fatty liver and necrosis, cyanosis. These are also symptoms of gossipol from breaking down blood vessels and blocked vasodilation via bradykinin B2 receptor, which then activates inflammatory bradykinin 1 receptor. Treated by extremely high doses of aspirin, it led to acute respiratory distress syndrome. According to a 1918 Ag Extension report, cotton seed fed to animals was of low quality that year, so perhaps high in gossipol, which isn't unusual. So, given wartime meat shortages, canned gossipol-laden meat of dead poultry and pigs, as in spam, may have been given to soldiers and sent to Europe, in which case it's likely that what stopped symptoms was lower doses of aspirin and getting rid of or consuming the toxic meat. 1960s. Dengue, an Ebola-like hemorrhagic fever found in cotton growing areas, becomes a major health problem that involves joint and eye pain, red blood cell fragility, and permeable blood vessels with plasma leakage, shock, fever, profuse vomiting, abdominal pain and hemorrhage, enlarged liver failure, hypotension, and again, same symptoms, and disseminated intravascular coagulation. Dengue fever spread to Southeast Asia in the 1960s, at the same time that cotton became a major industry there. In Uzbekistan, where a similar fever, Crimean Congo hemorrhagic fever, is common, poor cotton farmers are paid for their cotton with cottonseed oil. In addition, there is much interest in putting cottonseed in flour for poor people at 60% protein at the same time, as has been promoted by the industry. This is very problematic, as gossipol also breaks DNA strands. In 2002 and 3, severe outbreak of avian flu in China's Guangdong, Jilin, and Hebei provinces coincides with the SARS-CoV-1 in the same provinces. SARS-CoV-1 is more severe than avian flu, but excessive vasodilation as a reaction to blocked vasodilation is the same, like B1R, acute respiratory distress syndrome. Thus, it's likely from meat high in gossipol. Now, feeding animals cottonseed is banned in the European Union, and it should be banned in the United States. Do 5G microwaves cause heat-intolerant people to get COVID-19 leaky blood vessels? COVID-19 symptoms are the same as microwave sickness symptoms. Leaky blood vessels, excessive vasodilation, and that's how the most severe cases begin. Then there's permeable blood-brain barrier, inflammatory nitric oxide, hypoxia, dry cough, difficulty breathing, irregular EKG, chest pain, chilblains, fever and chills, heat shock, muscle and joint pain, fatigue, sore eyes, light sensitivity, lens opacity, sinus pressure, congested and runny nose, headache, tinnitus, dizziness, altered taste, gastrointestinal symptoms, decreased white blood cells, low melatonin, brain fog, disturbed sleep, anxiety, swollen glands, rash, confusion, and depression. And the same people are vulnerable to COVID-19 and microwave sickness. The diabetics, the obese, elderly, hypertension, heart disease, COPD, and they are all heat intolerant. In late 2019, COVID-19, or SARS-CoV-2, which is similar to SARS-CoV-1, Spanish flu, and dengue, symptoms occur in cotton-growing Wuhan province. Vasodilation and leaky blood vessels are a major cause of death and affects those with diseases related to gossipol, fatty liver, one of 3 top risk factors for death, hypertension, coronary artery disease, and obesity, which is from a low thyroid, in some cases, which is affected by gossipol. Fatty liver causes insulin resistance, which leads to diabetes. So diabetics may be exposed to gossipol. These people are heat intolerant, thus vulnerable to 5G microwaves, which were turned on at the same time. So they can't vasodilate to expel energy. And inflammatory bradykinin 1 receptor is activated. Bradykinin can be produced by microwaves. 5G induces inflammatory nitric oxide in nasal passages and heat shock protein 70. Now this is a non-thermal effect, so we don't even feel the heat. Heat shock protein 70 protects us from 5G, but cells of heat-intolerant or hypoxic people make inflammatory heat shock protein 90, which breaks DNA, prevents DNA repair, and assembles viruses instead of heat shock protein 70. So heat shock protein 90 inhibitors and heat shock protein 70 are in trials to treat COVID-19. These people also make inflammatory VEGF and platelet activating factor to expel excess heat energy, causing excess vasodilation, leaky blood vessels, and acute respiratory distress syndrome via the inflammatory bradykinin 1 receptor. Plus, enhanced absorption of 5G energy by blood vessels near the surface may play a primary role in initiating vasodilation. Using a supercomputer, biologist Daniel Jacobson found the cause of COVID-19 symptoms, the bradykinin B1 receptor. ACE2 blocks the B1 receptor. So, COVID-19 as an exosome would go to ACE2 to activate it, as in the 81% of people with few symptoms who make functional exosomes. However, hypoxic or low in oxygen cells of heat-intolerant people, the diabetics, coronary artery disease, hypertensive, and obese, can't make functional exosomes. So their exosomes go to ACE2 but enter it instead, as COVID-19 does, thus spreading symptoms. So COVID-19 as an exosome would go to ACE2 for virus entry point. Do dental x-rays and mercury amalgams cause conjunctivitis and measles rash? Measles appears to be from low vitamin A from x-rays and cottonseed oil and mercury fillings. The rash resembles the maculopapular rash of Kawasaki disease linked to mercury, and measles virus enters an immune component that expels mercury. Measles can damage the cornea and cause conjunctivitis and vision loss from low vitamin A, which is needed for vision, as found with measles. X-rays damage the cornea and cause conjunctivitis, perhaps from low vitamin A. For UV radiation depletes vitamin A, so X-rays likely deplete it as well. Notably, vitamin A expels inhaled mercury. There are also lesions in the mouth where dental work is done. Measles cases followed the use of dental x-rays and mercury amalgams. By 2000, safer digital x-rays and resin composite fillings were now used, and measles was eliminated in the United States. Measles point of entry. People with measles are low in vitamin A, and treating measles with vitamin A reduces mortality. This may be because vitamin A is needed to expel mercury via metallothionein, and radiation depletes vitamin A. Phagocytes also remove mercury from the body, and the monocyte receptor of SLAM acts as a mercury-removing phagocyte. So, exosomes made during mercury poisoning would be sent to activate the monocyte receptor of SLAM. This is where the measles virus goes to. So, people who are exposed to mercury, who make functional exosomes, would be able to expel the mercury. But if the mercury virus or exosome is engulfed by the monocyte receptor of SLAM, it deactivates it and spreads symptoms. So, for many years, measles was a very serious disease, including encephalitis. Mercury vapor, made worse with low vitamin A, also causes encephalitis. Many people also ate cottonseed oil that blocks vitamin A until 1960. So this is when things really changed. At least 1958, beginning, the American Academy of Otolaryngology, American College of Radiology, and American Dental Association curtail use of dental x-rays. 5 years later, the first measles and measles cases began a very clear decline. I mean, just plummeting. And then there's the first measles vaccine, and 1968 an improved vaccine when actually measles cases started going up again. So 1880s, the mercury amalgam fillings are used. 1908, dental x-rays becomes an entrenched practice. 4 years later, measles becomes common enough to be a reportable disease. So through the 1950s, x-rays are widely overused. Even feet are x-rayed for fitting shoes. So 8 years later, 1958, professional dental associations curb excess x-rays. Cases plummet. 1960, Americans also eat far less cottonseed oil, which blocks vitamin A. So 1963, 68, the first vaccine, then improved vaccine for measles. But then 1969, the measles cases rise again, and the EPA calls for fewer dental x-rays again. 1980, Public Health Conference on Records and Statistics, where assessment of overutilization of dental x-rays are of quote-unquote high priority. It keeps sort of creeping up. And then the next year, the measles cases drop by 80%. 2000, resin fillings, safer digital x-rays used, and measles is eliminated in the United States. But the removing fillings starts becoming common, and so measles increases. But then in 2020, due to COVID-19, there are few elective dental visits, only 13 measles cases. There are other maculopapular rashes. There's measles. There's also Kawasaki disease, which is a measles-like rash. The Kawasaki disease mainly affects Japanese children who eat a lot of fish. Patients also have fever and a runny nose. They are high in mercury and low in vitamin A. Then there is the Congo Outbreak. Since 2019, nearly 7,000 children with rash, fever, pneumonia, diarrhea, and encephalitis, identified as measles, have died in eastern Congo. This is where Ebola is and where most Congo gold is mined, by 200,000 miners, 40% children. Miners heat mercury in their homes to process it. Mercury vapor causes fever, maculopapular rash, pneumonia, encephalitis, diarrhea, lower limb weakness, and urinary retention. Now, these are measles symptoms, so it's all blamed on the measles virus. Their high vitamin A palm oil would help expel mercury, but their current cottonseed oil blocks vitamin A. Processing gold with mercury is illegal. There are fewer cases now, so they may be finally enforcing this law. Do Roundup and solvents cause Epstein-Barr virus, autoimmunity, lymphoma, and mononucleosis? Epstein-Barr virus, which is a herpes virus, have the same symptoms as Roundup herbicide, which is glyphosate. They are both linked to autoimmune diseases. They both affect B cells, lymphocytes, antibody production, and macrophages from damaged gut. They're also related to mononucleosis, linked to non-Hodgkin's B-cell lymphoma, and found the herpes virus, EBV, is found in over 90% of the worldwide population, and Roundup is called a ubiquitous contaminant. Roundup and autoimmune disease. Roundup has been marketed as harmless, so it's so widely used it's called a ubiquitous contaminant. Roundup-ready GMO crops were first planted in 1995, thus further increasing its use by 20-fold by 2016. It's even sprayed directly on high-gluten wheat, oats, and legumes in northern areas. However, the USDA never tests for residue on foods. Roundup is a phosphonated glycine plus formaldehyde in POEA as a solvent. We need glycine to protect and repair the gut, but Roundup on food would likely displace glycine in the gut. The gene for removing waste toxins is C1q, has many glycines, so C1q could be impaired if Roundup displaced its glycines. Impaired waste removal induces antibodies via B cells, and decreased C1q causes autoimmune disease. Also, formaldehyde damages the gut, so bacteria, toxins, and food escape, which also induces antibodies. Formaldehyde also increases B cells, plus it causes autoimmune disease. Solvents also raise risk for autoimmune disease, so by displacing glycine along with formaldehyde and a solvent, Roundup is thought to cause leaky gut and autoimmune disease. Epstein-Barr virus is also linked to autoimmune diseases, B cells, and leaky gut. Epstein-Barr virus enters at B cells, which make antibodies to damaged fragments. Epstein-Barr virus also enters at macrophages, which engulf them. Looking at Epstein-Barr virus as an exosome. If Roundup damages the gut and particles escape, exosomes would be sent to B cells and macrophages to detoxify them. So with a small dose, there could be few symptoms. But if one makes easily damaged exosomes or Epstein-Barr virus from excessive exposure or poor diet, these exosomes are marked for destruction. So antibodies to these exosomes or Epstein-Barr virus would be made to signal B cells to engulf them, and antibodies to Epstein-Barr virus are found with autoimmune diseases. Moreover, less of the glycine-rich C1q impairs macrophages, which would mean that waste remains in circulation, causing inflammation and autoimmune diseases. Epstein-Barr virus is found with celiac, lupus, irritable bowel disease, multiple sclerosis, rheumatoid arthritis, and type 1 diabetes. Now, celiac disease could well be caused by Roundup sprayed on wheat in northern areas, as you can see from the chart, starting really when Roundup was first sold. Roundup, solvents, Epstein-Barr virus, and multiple sclerosis. Multiple sclerosis has been linked to various solvents like isopropyl hand sanitizers, trichloroethylene, and alcohol. Both Roundup and EBV have been linked to multiple sclerosis. So this may be from Roundup's solvent, POEA, which as an inert ingredient hasn't been tested for safety. POEA increases penetration and damages cells, even to the point of destroying them. POEA does this more than Roundup active ingredients do. Toxins made by bacteria, Acinetobacter, which are found with multiple sclerosis, contribute to symptoms, as in other diseases. But bad bacteria are found in MS, like in other diseases, because they break down isopropyl, alcohol, and other solvents, which are petrochemicals, giving off harmful gases from the chemical. Myelin amino acids, threonine, lysine, and serine, are affected by solvents, and threonine was found to lower spasticity. Solvents were invented in the mid-1800s in France, and the first diagnosis of multiple sclerosis was in 1865 in France. So, with Roundup being so widespread, toxicity of the Roundup solvent may explain why Epstein-Barr virus is so prevalent in multiple sclerosis at this time. Roundup solvent and lymphoma and mononucleosis. Autoimmune diseases increase risk for non-Hodgkin's or B-cell lymphoma, where Epstein-Barr virus is also found. Roundup is also linked to this cancer, and antibodies to glycine are found with it. Many solvents also raise risk for non-Hodgkin's lymphoma. So B cells would be activated, becoming cancerous with prolonged exposure to Roundup. Epstein-Barr virus, as a functional exosome, activates the MYC oncogene, which induces cancer cell death, so it protects from cancer. Epstein-Barr virus is found with 90% of the mononucleosis cases. A solvent that is related to the Roundup solvent, polyoxyethylenamine, PEG, is used for lipstick, so it may cause mono, which is called the kissing disease and is spread by kissing. Mono also raises risk for B-cell lymphoma, so PEG would cause cells to make exosomes, or Epstein-Barr virus, to detoxify and repair via B cells, macrophages. An increase of B cells in mono, Epstein-Barr, as an exosome, increases B cells, is evidence of foreign substances in the blood due to damage from PEG solvent. Another lipstick solvent, acetone, may cause the cold sores where herpes virus, HSV1, which is also spread by kissing, is found. Notably, HSV1 induces philopodia, which closes wounds, such as the cold sores. Here's the timeline. 1950, the glyphosate was invented. 1958, Burkitt's lymphoma, which is linked to Epstein-Barr virus, appears in malarial Africa. Chemicals are tested before getting a patent, so trials may have been in Africa, as is not uncommon. This disease is still found there, and Roundup could still be used there in the original form to control mosquito habitat, since it also damages mosquitoes, thus lowering malaria. In 1964, glyphosate was patented as a metal chelator, as it displaces zinc, which is a major cancer fighter, iron, calcium, and manganese, major essential minerals for people. 1974, glyphosate was marketed as Roundup for use as an herbicide. The same year, non-Hodgkin's lymphoma and autoimmune diseases increase. In 2019, 3 pesticide applicators win their case against Bayer for non-Hodgkin's lymphoma. Does venom cause rabies paralysis? Rabies symptoms, which are agitation, hallucinations, and paralysis, are caused by blocking the nicotinic acetylcholine receptor, since this receptor is needed for proper movement and thinking. Venom, which many animals use to deactivate the nervous system of their prey, also blocks the nicotinic acetylcholine receptor via its poison, PLA2. Another similarity is the rabies virus spike protein amino acid sequence is the same as for venom PLA2 neurotoxins. Notably, antivenom atropine is a traditional and effective treatment used for rabies in India, and India is the country with the most snake bites as well as the most rabies. In rabid dogs, the virus is present in saliva. Dogs sometimes try to kill snakes when they are allowed to roam, like in India, so the dog could get venom in its mouth. This would quickly cause agitation and biting dogs are the source of 99% of human rabies. So a dog with venom in his mouth would pass the venom on when he bites. In modern countries, there are few rabies cases of dogs or humans, but dogs are generally controlled, so are unlikely to encounter snakes or other venomous animals with PLA2. Rabies virus enters nicotinic receptors, as well as receptors for molecules that would be needed to repair the nervous system, low affinity nerve growth factor, and neural cell adhesion molecule. After biting a venomous snake, the venom PLA2 in a dog's saliva would deactivate his nicotinic receptors. So, exosomes and rabies virus would be sent to the nicotinic acetylcholine receptors and nerve repair receptors. But if the exosomes are dysfunctional due to excessive inflammation from a large dose, the exosomes would deactivate them instead and be replicated, thus spreading symptoms. You see first how there's a toxin first. The toxin does the damage, and then the exosome repairs the damage. So venom, PLA2, causes paralysis. Right here, it deactivates the nicotinic receptors in two ways, the outside ones and the inside ones. And but then exosomes with the glycoproteins here, they go right to this nicotinic receptor so they could activate it. But if they're dysfunctional, they will inhibit them instead. So, to summarize, viruses as exosomes are associated with toxins that cause the same symptoms by the same mechanism. This has been described for polio, human papillomavirus, West Nile virus, Ebola, yellow fever, COVID-19, measles, Epstein-Barr virus, and rabies. So, in order to effectively treat the symptoms and to stop the continued suffering, it is essential to acknowledge and to avoid the toxin behind the symptoms. Thanks for watching, and please like, subscribe, and share. And for more videos on this subject, see my YouTube channel, and got 2 websites that you can contact me on. And this information presented is intended for educational purposes only. These statements have not been evaluated by the FDA and are not intended to diagnose, cure, treat, or prevent disease. Thanks for watching.